Hi, my name is Kirby Von Edwins. I'm a general clinical cardiologist here at Arkansas Cardiology here in Little Rock. I've been in Arkansas a long time. Went to high school here at Little Rock Christian Academy, and then went to undergraduate at Ouachita Baptist University. And then all of my medical training was at the University of Arkansas for Medical Sciences here in Little Rock, both medical school, residency, and fellowship. So I like to tell people it's kind of by accident. Like, I started in high school, you like to tell parents things that make them proud. So you say, hey, I want to be a doctor, and it makes everybody happy. But it did all, that's like the wrong reason to do it. But I started doing that and then realized it was actually a calling. So when I started actually plugging in, I got lucky by accident, basically. Fell in love with helping patients sometimes at their scariest moments, holding hands, crying either good tears or happy tears. I found that was a time where I thrived, actually. I'm a general clinical cardiologist, which means that I kind of take care of the over-encompassing cardiology diseases, but that's a whole thing from preventative things to starting at the beginning before problems exist, trying to prevent them from occurring, or at the back end trying to mitigate problems that have already occurred. But I'm more in the general sphere, so I do a lot of imaging, cardiac imaging, so ultrasounds or echocardiography of the heart, EKGs, or even things like CAT scans of the heart to look at arteries in a non-invasive way. That's kind of where I find my focus in the field. So I hope to be kind of down to earth. I hope that they feel like there's a person on the other end, that this white coat isn't intimidating, and that they feel like they're heard by a normal peer. Because taking care of a person requires, I think, a personal relationship. So I think that's something that I expect out of my clinic encounters, and patients of mine can expect that from me. And I think that once you have that relationship, taking care of things like the physical health becomes that much easier and I think more effective. Yeah, you can find me watching episodes of The Office on rerun if my wife isn't in the room, because she despises it, unfortunately. Or maybe on the weekends going fly fishing. That's something I like to do in my free time if I have a full day to spend out there. Or otherwise just hiking, enjoying the outdoors Arkansas nature. Right, yeah. I am a man of faith, so it's actually awesome to be working at a facility that feels the same, because I think that a person's health is not physical alone, it's spiritual, emotional, and being able to tie all those together, I think, actually leads to better outcomes and a better relationship with providers and patients. So that's something I'm really excited about to work here. I'd say a tip is that it's never too early, and it's definitely never too late to see a cardiologist. So I'm willing to see anyone from the beginning, middle, and end of their health spectrum. And especially people that are healthy but just nervous, I think that's never a wasted visit to come and talk to a cardiologist.